Well, at Guy's and St Thomas's, we were one of the first adopters of CardioCel. And immediately, as a surgeon, one of the things that you find is, one of the things you notice, without going into all the biomedical engineering aspects of it and so on, is the way the tissue handles. And right from the beginning, and even later on as we gain more experience, CardioCel has become our tissue of choice. We find the handling is ideal and has improved with time. So from a technical perspective, we find the handling is exactly as we need it. The fact that it's acellular and there's been so much investment and thinking behind the technology, particularly the acellularity, which we understand limits the degree of calcification that can possibly occur, is an added benefit for the longevity of the material and how it performs in the patients in the long term. The most important take-home messages are the fact that we've used it in over 127 patients. Of those, I think I personally have used it in over 110 patients. We found, as I said earlier on, we found the tissue handling to be excellent. And in the long term, we've found it to be usable in different settings, in different positions within the heart, and have found it to perform in a very good way in the short and long term. So we've used it in reconstruction of the outflow tract, both in the left and the right side. We've used it in valve repairs. Some of the procedures we do are stage procedures, and we've been able to look at the behavior of the material in the short and medium term. And there are some positions with experience that you learn it's not ideal. There is no ideal bioscaffold or material. But I think that currently CardioCel is probably the best on the market. One of the impressive things about Admedus and the way they've focused on development of the material is that they're continually looking at innovations and improvements. And certainly, personally speaking, I'm looking forward to the development of newer, thinner CardioCel, which I think will be even better for tissue handling and use in different settings, particularly in smaller children.